Hi guys, Nurse Q here. As promised, this is part 3, tips to create an aesthetic cover letter and resume, although this video is going to focus on the resume portion of your application. I had so many ideas that I wanted to share with you guys. Literally, there's not enough time in this video for me to be able to do that. So I'm going to throw out some quick tips. If you have questions, as I always say, you can DM me or leave a comment. And I will get back to you, I promise. So, tip number 3 is to be very strategic in your language. Every bullet point that you have on your resume, you want to be directly related to the position that you're applying for. That may not seem possible if you don't have aesthetic experience, but you can do it. Especially if you have nursing experience, especially if you have customer service experience where you have made sales as far as products and things of that nature. That is very useful and very helpful for the field that you're going to be entering. Most of you might know there's 2 types of skills you can include on your resume. The first is hard skills. The second is soft skills. We're going to focus on hard skills. So, one of the first ones, needle injections. Now you guys may be thinking, I've never administered Botox or Xeomin or anything related to neuromodulators. However, you probably have given insulin, okay? So you're used to subcutaneous injections. It's not the same, but what that shows is you have experience with the needle. You're familiar with angles. You're familiar with aseptic and sterile technique in order to prevent infection, right? Clean the site, how long you clean it, what you use. All of these things are valuable skills that you're bringing to the table. So do not underestimate the value of your experience that you already have, even if it doesn't seem directly relatable. Another skill I'm sure all of you guys have is your assessment skills. You may not be doing head to toe in a medical spa or a plastic surgery office, but you still have to be able to assess the skin. You have to understand the anatomy and the physiology of it. And hopefully you do. If you don't, maybe that's something you're going to have to review, which is no problem, but make sure you do that. And I know that facial anatomy is not something that we learn in nursing school. Perhaps they should change that. But anyways, I am self-taught, but bonus points if you can find a certification or a class to take to learn that. And you want to put that on your resume as well.